Advanced care planning is bigger picture thinking, which is consultant thinking, which is examiner thinking. Hello Dr. Humans, welcome back to another long case lesson. This week we'll be diving into how to discuss advanced care planning in your long case. Now, advanced care planning is just part of what we do in clinical practice. We should be looking for an advanced care plan in every single patient who's admitted to hospital, because if we as doctors do something that's outside of that advanced care plan, it has legal implications. So, most inconvenient to one's day. But the construction of this document usually happens in the outpatient setting, typically with an advanced care planner, a specialist nurse, a social worker, or with the patient's GP. So if you're a doctor in training, you're working in inpatient land, the advanced care plan is something that you're going to interact with, but you're not necessarily having those conversations with the patient about their advanced care plan. So I wanted to make a little video about advanced care planning as it pertains to your long case, because advanced care planning is bigger picture thinking, which is consultant thinking, which is examiner thinking, right? So your examiners are going to have advanced care planning top of mind if it's relevant to your long case patient. Now, at its very basic level, the advanced care plan is designed to speak for the person when they are no longer able to speak for themselves. And it has two key themes. Usually it has a statement about the patient's values, what's important to them, and what makes life worth living from their perspective. What does quality of life mean to them? So, for example, a patient might say that quality of life is being able to communicate and spend time with their family, whilst not being able to communicate would be a life not worth living to that person. Or other patients might say, I don't want to be in a nursing home, I want my independence at any cost. And so if I'm not living in my own house, then that's not life to me. You know, that might be a patient's value. So nothing's right or wrong, it's about what your patient's perspective is. And so quality of life is a very individual thing, but the advanced care planning document should capture those value statements of the person. The other component of the advanced care plan is the patient's wishes around their medical treatment. So, of course, patients cannot demand healthcare that a healthcare professional deems to be futile or harmful. So we don't have to put the treatments on the table for the person if we don't think they're going to be beneficial. But the patient can obviously put out their wishes of the treatments that they would like to receive if they were offered to them. But on the other hand, patients definitely have the right to refuse treatment. So the advanced care plan or advanced care directive will include the patient's wishes around treatments they would accept if it was offered to them, but also treatments that are unacceptable to them, that they do not want, and we must abide by that legally. Okay, so that's the lowdown on advanced care planning documents. Now I'm going to give you a way to frame your discussion around advanced care planning in your long case. And for this, we need three key headings. One is physicianly forecast. Why is advanced care planning important in this person? Number two, patient values. What does your patient value? Is it quality of life or quantity of life? And what does quality of life even mean to this person? And number three, what are the barriers to advanced care planning and how do we overcome them? Now, of course, if your patient has an advanced care plan already, it's good to know what's inside that document and see if it aligns with, you know, what you think is realistic for this person, right? So it's good to know what's inside the document, because if it doesn't align, then that can be a discussion point. But more often than not, we're having the advanced care plan discussions in the long case in the context of a patient who doesn't have one, but we think should have an advanced care plan. So that's what we're going to be covering today. And obviously, you must tailor this to the individual in your long case. Okay, there's nothing generic here. So signpost number one, the physician forecast. This is where you tell the examiners why you think it's a good idea for this patient to have an advanced care plan. Now, you could make the argument that most people with a medical condition or people above a certain age should have an advanced care plan. But I'd say that they're particularly valuable in people who are at risk of hospital admissions, organ failure, acute cardiovascular and cerebrovascular events, or those who have a limited prognosis or a neurodegenerative condition. So you, as the physician, can see the patient's trajectory and you can see the rationale for this advanced care plan given that trajectory and the possible events that they might face, right? And so you're going to tell the examiners what you think about that. Then, number 2, patient values. So we really need to understand our patients' beliefs and values. Do they prioritize quality of life or quantity of life? And what does that mean to them? What constitutes a meaningful quality of life to them? Is it independence, their cognition, ability to communicate, spending time with grandchildren, being able to socialize? What is it that makes your long case patient's life worth living? And what would be the opposite of that? And number 3, barriers to the advanced care plan. So this could be a number of things. Maybe your patient doesn't know about advanced care planning. Maybe they just need to be orientated to the whole process. Maybe it's the influence of family members not wanting to upset people, or maybe shying away from their own mortality, right? These are difficult discussions. Maybe they just don't want to have difficult discussions. Maybe it's for religious reasons. And a lot of people just philosophically don't see the relevance of it because they're living their lives right now. They're pretty well, they don't anticipate any change in their health, so they just don't see the point. And another reason is they could just be busy and procrastinating, right? They might fully want to do the advanced care plan and they just haven't got around to it yet. And so once we outline the barriers to creating the document, we can help them to overcome the barriers by providing education, inviting family members to a future consultation, arranging an advanced care planner to sit down with them and do it one day in a dedicated space. Lots of things we can do. And if you have a patient who's having difficulty just engaging with the conversation, I would typically throw them a hypothetical scenario. So I would say something like, heaven forbid you were to have a stroke in your future and you were unable to speak for yourself, this document would speak on your behalf. What would you want the document to say about your medical treatment? And patients typically know what a stroke is, and so it's an easy hypothetical for them to relate to, and it's also a big fear for the majority of people. And so using that as a scenario does a couple of things. It helps to explain what the advanced care planning document is, a document that can speak for you when you're unable to speak for yourself, and it also opens up the conversation about what impairments would be tolerable to them in future, in terms of their loss of independence, communication, cognition. What impairments could they live with and which ones would they struggle to live with? Is there anything like that they would like to place on this document for those future hypothetical scenarios so that the doctors and their family know what to do? So I would gather that perspective from them, and then I would typically refer them on to an advanced care planner because we're lucky enough to have them at our hospital, and they will sit down with the patient and help to construct the document in a dedicated time slot. So that's what I do in real life in order to open up that conversation about advanced care planning, especially in patients who don't really see the relevance of it initially. So when you're taking the history and you ascertain whether the patient has an advanced care plan or not, if they don't have one and you think that they really should have one, you can ask them, why don't you have an advanced care plan? So there you're figuring out the barriers to this. Is it education? Is it being busy? Family influences? Just not wanting to engage? What is it? And for bonus points, you could then go on to ask, would you say quality of life or quantity of life is more important to you? And they're likely to be able to answer that question pretty quickly. And then you can explore what that means to them. What is quality of life? And if they're struggling to understand the concept of that, you could give them that hypothetical scenario. Down the track, heaven forbid, you had a stroke, you were unable to speak for yourself. What would your wishes be around your healthcare? What makes life worth living? And see what comes up. That's going to be absolute gold for your discussion, especially if you think that advanced care planning is something that might come up. But as always, if you haven't actually sourced that information from the patient and you find yourself answering this question about advanced care directives in the discussion with the examiners, you should talk through what you would ideally like to do in your next future consultation with the patient, using those signposts I mentioned. So let's see those signposts in action. Jimmy does not currently have an advanced care plan in place, but given his age and comorbidities, I do think that this would be valuable, and he is at significant risk of hospitalisation and future cardiovascular and cerebrovascular events. During my consultation today, it was evident that Jimmy values quality of life over quantity of life, with his quality of life currently evolving around functional independence, being able to drive, and playing lawn bowls 3 times a week. In terms of the barriers to advanced care planning, Jimmy is fairly philosophical when it comes to his health, and on top of that, he's very worried about upsetting his family members by having these discussions. In order to overcome these barriers, I would, with Jimmy's permission, invite relevant family members to future consultations where we can open up the discussion around advanced care planning in a safe and supported environment. During that consultation, I would educate Jimmy and his family about the purpose and the value of the advanced care planning document and frame the discussion around potential future events that could crop up and threaten his independence and quality of life. Following this initial discussion, I would progress the creation of the advanced care planning document by recruiting the help of an advanced care planner to sit down with Jimmy and construct this document in a dedicated session. So something like that. It's really hard to give you something hard and fast here because every patient is unique, but I think framing your discussion around those 3 things is likely to help you to organise your thoughts about your advanced care plan in your long case. And I would really recommend that you practice in every long case you do, having a wee chit chat with yourself about these advanced care planning discussions, using some of those ideas and seeing what works for you. It's the kind of thing that can really rattle you on exam day, but if you're working your physicianly advanced care planning muscles now, all the time, and you're putting these pieces together and thinking about how you would actually progress that part of your patient's care plan, then you're not going to be tripped up by it on exam day. You'll be seeing it as a routine part of physician life, which is exactly what it is. So I hope that helps you as you prepare for your long cases. I really hope it's going well. And if you would like some more help with your long cases, I have a whole program dedicated to installing long case confidence. It's called Rock Your Long Case. All the content is now delivered and available in its entirety. It's all in there. All the practice cases where you learn how to construct and prioritise your issues list, how to discuss said issues list, and it's an absolute shortcut when it comes to learning topics for your long case discussion. Transplantation, CKD and dialysis, rheumatology, all the tricky gen med topics. We're talking obesity, diabetes, peri-op med, chronic pain, depression, falls, osteoporosis, the list goes on. It's all available right now, and for the month of May we have now added the brand new long case coaching portal. This is booking out as we speak and it's exclusively available to our Rock Your Long Case students. So if you are looking for a course specifically designed to boost long case confidence and have you thinking and sounding like a physician ready for exam day, then it's not too late. You can sign up today using the link below. And otherwise, stay tuned here on YouTube for some more long case lessons. And if you have any suggestions for those YouTube videos, please let me know what you need from me in the comments below. I'll be making some content over the next month to help you on your journey to the finish line. I'll see you soon. Bye!